We also aspire to be an exemplar of team science by building the cross-sector partnerships that, in my view, really function as the wise crowd to tackle complex and seemingly intractable problems. Like Dr. Bertagnolli said, many problems can't be solved with a single institute, a single academician, or a single company. We really do need to work together. So I think it's fitting that tonight our first award will be presented as the Charles A. Sanders Partnership Award. This award is named after our founding chairman, who's the former CEO of GlaxoSmithKline, but it's an award that recognizes individuals or organizations that have really made significant contributions to our work to build and implement these private-public partnerships in support of the mission of the NIH. The awards are nominated by the staff of the NIH and are selected by a committee of our board members. So this is an award for partnership based on the experiences of the people who are trying to build and manage these partnerships, and they kind of have the inside knowledge in terms of what really constitutes a great partnership. So I'm going to start by honoring the National Institute for Neurologic Disorders and Stroke, affectionately known as NINDS, who has partnered with the FNIH on several diverse projects. Most recently, our Accelerated Medicines Program for amyotrophic lateral sclerosis, otherwise known as ALS, as well as our Parkinson's disease and related disorders that was launched earlier this year. We're also honoring Abbvie, who is a longstanding member of the Biomarkers Consortium and has participated in more than 20 of our projects through the years. And we have a special recognition tonight for Robert and Sarah Newcomb, who established the Robert Whitney Newcomb Memorial Fund in honor of their son, who, among other things, worked at the NIH. Since 2001, this fund has provided substantial support in training and educational opportunities at NINDS, so there's kind of a symmetry here. So I'd like to invite Gail Newcomb, the daughter of Robert and Sarah, and Dr. Koroshetz, the director of NINDS, to the stage. But I'd also like to invite Dr. Steve Paul, our board chair. I just mentioned that unfortunately Abbvie leadership is not here to accept their award because the team is preparing for an earnings call tomorrow morning. And those of you who have been in industry know that that is not a fun time to attend a party. So please join me on the podium here. So the Foundation of the National Institutes of Health honors all three of our awardees with the 2024 Charles Sanders Partnership Award for their significant contributions to the FNIH's work in support of the mission of the NIH. So we're going to present the award, maybe have a word, and then take a picture, if that's okay. All right. So I think we'll start with you, Sarah. It's very heavy, and I see your hands are bent. Would you like me to? Okay. Want to say a word? Sure.
Thank you. It's a great honor to accept this on behalf of my parents, Robert and Sarah Newcomb. Unfortunately, they couldn't be here today. Our whole family is based in science, and that's been all of my life. And we would like to thank Dr. Susan Ray's lab for all of the work that they've done on our family's behalf. Thank you.
So now I see that my teleprompter has left the screen, but I do know Dr. Koroshetz, so I can congratulate him as really a wonderful institute director, but also a terrific leader and a person who we turn to when we need advice or counsel about problems that aren't even under the domain of the NINDS. So Walter, thank you for your leadership of a fantastic institute in an area that is increasingly important to the health and well-being of all Americans. So thank you for that.
Okay, so 2 minutes. So I just wanted to say that really honored by the award on behalf of the people at NINDS who work on these projects, but they're done with the people at FNIH, and so it's a real team effort. So have to, hats off to Alessio Travaglia, who is the neuroscience head, and Joe Manetsky, who I call when I run into trouble. And I would just say that, being at NIH the length of time I've been there, I can see that, it's kind of like we're trying to build a house. We're trying to build a house based on the science, but the people who live in the house are the people who take the science and bring the treatments to patients. And that's the industry folks. That's the people who have the diseases that we're trying to solve. And to not have that ability that FNIH allows us to talk to folks and work on joint projects, that is just so important to us as we try to deliver on the taxpayers' investment at NIH. And so I just can't overemphasize how important FNIH has been to NINDS. And I feel a little bad about taking an award for diseases that don't have good treatments. And so maybe when we get the treatment, you can invite me back. But thanks very much.